Kuma riria bururi wambiriirie kwandikithia namba ya arwaru aingi a murimu wa COVID-19 haho ya murimu uyu ni ihurire muingi umuthi gukiandikithia namba nini ya arwaru a murimu uyu aria ni 59 thutha wa andu 354 guthimwo rungu rwa mathaa 24 ona gutuika thirikari yugite o uti kuonania namba ino ni yambiriirie gucoka thi.
This therefore brings to total our number of positive cases in the country to 4,797 cases, out of a total number of samples tested so far being 142,366. All the 59 positive cases are Kenyans, with 47 of them male and 12 of them female.
Na niguo kunyihia gutamba kwa murimu uyu guku bururi-ini, Ministry ya Ugima wa Mwiri ni yambiriirie mutaratara wa guthomithia muingi iguru rigie murimu uyu matura-ini manyitanire na ikundi ngurani cia muingi undu umwe na arugamiriri a nyumba 10 itanya-ini ria kumenyithia muingi oma na maheni ma murimu uyu.
Our new approach will involve close working with community-based groups, which include the non-governmental organizations, civil society organizations and other stakeholders, with the aim of utilizing these groups in educating our people in the containment of the spread of the virus. And this is especially important because Kenya has a large number of these groups who work hand in hand with our communities, and therefore we should leverage on this resource.
Kurigana na Dagitari Mwagangi, arigitani akwirutira aria ni 59 aria mari kaunti-ini ciothe 47 ni mareketie gukinyira micii tanyihire milioni 12 kuria marathomithia muingi iguru rigie gwithema kumana na murimu uyu.
It is important to note that this community engagement strategy also has a role when it comes to home-based care and isolation. As you're all aware, we've recently launched our home-based isolation and care protocols, and this has been in conjunction and in line with WHO guidelines.
Rere thirikari eruguritie mutaratara wa arwaru a murimu wa COVID-19 kurigitirwo micii-ini. Ministry ya Ugima wa Mwiri yugite kamiti iria ithuritwo kuhitana na COVID-19 ni ciguteithiriria hanene. Guku Dagitari Mwagangi akiuria andu kuoya kanyaga kuhuthira kamiti ici uria kwagiriire niguo kumenya wega uria urigitani micii-ini uratafanio.
And at this point I would challenge each Kenyan to really ask themselves, have they engaged with their community health committees? These committees are present across each and every county and are there to facilitate one in terms of our community health strategy approach and now our home-based care approach. We do also have the Nyumba Kumi initiative. We have estate management committees. We've seen a lot of estates come up with innovative mechanisms of controlling this spread of coronavirus.
Mwinini wake Director General wa Ugima wa Mwiri Patrick Amoth oigite kaunti itiganite nirikitie kuheana macokio mao mamehaririria ma kuhitana na murimu uyu taitada jiganu.
But remember, it's not just a question of structures, physical structures, because you also require human capital to be able to offer the services when you have the required bed capacity.
Maya magithiaga na mbere kaunti ya Nairobi ni wetongoretie hari namba ya arwaru kuria yandikithitie andu 28 umuthi, kaunti ya Mombasa ikiandikithia andu 21, kaunti ya Kilifi iri na andu 3, kaunti ya Kiambu na Machakos cikiandikithia andu 2, Bungoma, Kisii na Uasin Gishu cikiandikithia mundu umwe. Handu-ini ha Kameme TV Getwo Waithira wa Kihara.